in 2012, my mom lost her job. And at that point, we started putting two and two together and realized that there was something going on. And it, much like some of you, it took us 2 years before we could get a correct diagnosis of FTD. And once we made that diagnosis, we had a lot of questions and we wondered what to do next. And so I want to share a few things that we did as a family and some of the resources that are available through AFTD. And Karen will talk a little bit more about some of the local resources that are available. And I think that what we're hoping is we can add tools to your toolbox, and you can go away from here armed with some things that will help you as you progress on your FTD journey. I sent a link in the chat to download this book. It's called The Doctor Thinks It's FTD, Now What? And this is one of the resources that AFTD has available on their website. You can download it in a PDF version. You can also talk to the AFTD and they can send you a paper copy as well. If we were meeting in person today, I would have copies of all the newsletters and booklets for you. But since we're doing it over Zoom, you'll have to call and get those sent if you'd like a paper version of it. But this is a good book to use at the start of your FTD journey and then come back to refer to as you need it. It takes you through 5 categories and kind of the next steps that need to be done in each of these categories. And these categories include learning about the disease, creating your care team, addressing legal and financial planning, developing a positive daily routine, and addressing safety issues. At the back of the book, I think it's on page 32 and 33, they have these 2 checklists. And I think we're talking about a lot of these things today, and a lot of the resources that we have available can help you with some of these tasks on your checklist. But this is a good thing to come back and keep referring to as you need it. So hopefully by the end of the day today, we'll have helped you find some of these things that help with these tasks. First off, I want to talk about some of the resources that are available from the AFTD. AFTD was created in 2002 by a small group of volunteers, and it has grown over the years to now include 20 full-time employees and volunteers throughout the country. We do not have local chapters like the Alzheimer's Association, so they rely on volunteers throughout the country to work within each community. We're lucky to be a part of that, and it's been exciting to see the organization grow and everything happening in the Seattle area grow in the time that I've been involved with FTD. You will see it everywhere, and I'll probably talk about it several times, but the helpline is one of the most important things I could suggest that you use. There's the email address or the telephone number, and this is staffed by full-time staff at the AFTD, and they will return your call or your question within 24 hours. I believe that's their goal. So please take advantage of the helpline if you ever have questions or you need resources sent to you, or you need to help navigating whatever comes up. They are a good resource. The AFTD has a great website, and it has so much information we can't even begin to cover it. But they also have a website for kids and teens, and that's at aftdkidsandteens.org. They have 2 sections of this one. One is geared towards young kids, ages 4 to 12, and another one is geared towards kids 13 and up. So if you have family members who or if your loved one has FTD and you have young kids or teens around, this is a helpful website to use. AFTD has lots of publications. They have newsletters that come via email, newsletters that come in the mail, and all kinds of things that help to educate and provide resources for families. I'll talk about one specific one here. It's called the Partners in FTD Care. And it is a quarterly newsletter that is actually designed and geared towards professionals, but I think it's super helpful for families and caregivers as well. they offer practical solutions to things that are common FTD issues. For instance, this one here shows, it talks about understanding and managing apathy to improve FTD care. They have specific issues on FTD with ALS or primary progressive aphasia. So all of these past issues of Partners in FTD Care are available on AFTD's website, and it really dives into great information about different things that might come up when you're caring for somebody with FTD. There are additional publications that AFTD produces that can be valuable as well. We already talked about The Doctor Thinks It's FTD, Now What? There's also a new one that's called Walking with Grief, Loss in the FTD Journey. There is one about genetics, and one about what to do about the kids. There's also links to the videos and stuff, and I can show you where to find those in just a minute. So all of these are available to download in PDF form or in hard copy form if you'd like one mailed to you. One of the most beneficial resources that AFTD provides is connections with other families who are experiencing the same thing as you are. We have FTD affiliated support groups throughout the country, and we are lucky to have 2 in the Seattle area that meet. Prior to COVID, they met in person once a month, and now we're meeting virtually. I'll skip ahead here. This is our local support groups that are meeting in the Seattle area. And actually Steve and Karen and Carol, I noticed she's on as well. So all of our support group leaders are here today. And so we're lucky to have this group of volunteers working to help our families in this area. There are lots of phone groups that have grown out of the need recently because we can't meet in person, but there are specifically support groups that are targeted to individuals like people who have FTD with motor neuron disease or ALS. There's support groups for parents caring for FTD children. There are support groups for men who are caregivers. So all of these individual unique support groups can be accessed by calling the helpline or visiting the website for more information. AFTD has Facebook groups. I'll show you what one looks like. This is the Facebook page for the official Association for Frontotemporal Degeneration. So if you go check out Facebook, you can look for this one. There are also there's a closed Facebook group for young adults, so people in their 20s and 30s who have a parent with FTD. And if you want to access that support group, you can contact the helpline and they can help you with that. The AFTD has respite and travel grants. The respite grants are available for caregivers. It's an annual amount of money, and they can be used to, like it just says, to provide respite for a caregiver. There are travel grants, so when we can have conferences in person again, they offer travel grants to help offset the cost so you can travel to conferences. And there are also quality of life grants that are available for FTD patients. And that comes in a form of, I think, a Visa card that you can use to, maybe enroll in a class geared towards people with dementia, or maybe buy art supplies if that's something you enjoy doing. So there's a lot of options there. So I'd encourage you to check out for now, the respite grants and the quality of life grants. And I'll show you in a minute where to find those. I did mention the conference. Because of COVID, they canceled it this year, and next year's conference, I think, will also be virtual. And those conferences are held in different places throughout the country. And usually they do one on the East Coast and one on the West Coast and then one somewhere in the middle. So we look forward to being able to meet again in person in the future. I'm going to take a minute here and actually open the website with you. I'm going to see if I can make this work. And I think that being familiar with the website is one of your best tools that you will have. I mentioned, I think I forgot. there's a whole section on COVID-19 and FTD. There's the COVID-19 and FTD button. So you can click here and find all kinds of information and resources about what it's like to take care of families members during COVID. This is a great tab here. So this Find Help tab, and if you come down here to resources, this is where you'll find access to and a link to a lot of great things. This, of course, you can find the helpline here. There's the phone number and the email address. This is where we access the grant information. So if you click this link here, it pulls up information about the respite grants, the travel grants, and the quality of life grants. These awareness cards here are easy for you to print out. And I think Dr. Demoto O'Reilly mentioned them too. But you can have these on hand to give to people when you're in stores or restaurants or doctor's offices that can help explain the behavior or the language that's going on. There's cards here for people who are diagnosed. There's cards here for people with PPA, cards for care partners. So you want to check out those resources there. Another helpful tool is this provider letter. And this letter lets care partners and persons diagnosed inform other healthcare professionals about FTD symptoms and ways that they might be able to help. It can also be used to give to lawyers and other family members or even law enforcement officials. So you can download and print this letter to be used. This page here has lots of different publications. These are the ones we talked about. And you can download PDF versions of them here. And let's see, a couple more things. There is other great lists of resources and recommended reading here. And there's more here than you even just really want to spend time on. But I just wanted to point out a few of these resources that are available on AFTD's website. And if you ever have any questions about FTD or what the AFTD can do to help, you're welcome to reach out to me. And that's what I have. I'll stop my sharing there. Okay.
Maybe best thing I think we can do is to be proactive, to get things set up so that they work well. Just like when we all had 2-year-olds, we baby-proofed our house. We put those little things in the electrical outlets. We cleared the tables of breakable things. And that way our children could wander through the house safely and we didn't have to be ever constantly vigilant. I'm not saying our family members are like babies. I'm not saying that at all. But I am saying that like we did then, it might be helpful that we arrange things in our lives so that we can function easiest. We give up having whatever things we did that worked so well when everyone was well, and we now move to a place where we set things up so things work for who we are and who we're living with in the current day. And saying that, I also acknowledge that that's a moving target. Things change all the time, but best we can. So next slide. There, thank you. What we really want to do is this, make plans before the crisis. We want to get our ducks in order. So next slide. I'm a social worker and my strong suit is not legal and financial matters, but it is where I want to start today. And I want to start there because I think it's so critical that you all look at this if you haven't already. I really encourage you all to revisit your wills. If you haven't changed your will since you've gotten this diagnosis, I really encourage you to go see an estate attorney or an elder law attorney now, because whatever you arranged 5 or 10 years ago probably isn't the same situation as it is now. I suggest an elder law attorney, even if you're not old, because they are really good at figuring out how to they may be able to safeguard money, not only for you, but also for the person with the disease if something happens to you. So I sent Mary a resource list. Did I send that to you, Mary, and did we get it sent out to everybody? Hopefully.
I'll be sending out resources after the event.
Wonderful. So I created a list that is certainly not comprehensive, but has much information on it. And a lot of the things I talk about and the things that Joanne talked about are on the resource list, so that you don't have to furiously write down phone numbers and addresses at this point. So estate attorneys, elder law attorneys, very important to revisit your will. Similarly, I think it's important to redo your powers of attorney. Typically, we give our spouses our power of attorney. But I have to ask you, is your spouse right now a person who could make good decisions for you? And if they can right now, will they be able to into the future? I fear not. And so I really encourage you to take the power of attorney away from them, as painful as that is, and give it to someone who really can make good decisions for you and for them into the future. Also, the durable powers of attorney for healthcare, we all are encouraged to sign those, to create those in our doctor's offices. If you are able, this might be a good time to talk to your family member about what they want in terms of healthcare plans, or if you can't do that with them anymore, for you to put in writing what you know or you think they would want. So just something you need to put on your list of to-dos soon. Next chart. Next slide, sorry. The other thing that I encourage you to do is to know as much as you can about what your spouse knows about. We all share tasks in our lives, right? I do the grocery shopping, my husband does the laundry. I pay the bills, he pays the taxes. I encourage you to begin to write down, to ask all the things that they know about. If they do the finances, where are those finances? Where are they kept? What are the passwords on your on their computers so that you can access the information whenever you need them? If you have people who work in the house and they keep a list of them, find out who those people are. It will make your life easier over time. And I encourage you to write all of it down. Early in COVID, I said, I've been saying this to people for years, you have to know the other half, your spouse's, the information that they hold. I've been saying that for years. And so finally, early in COVID, we had some time, I made my husband tell me all the stuff I didn't know about our finances and our household things. And then I went to bed that night and woke up the next morning and I couldn't remember any of it. So then I made him go through it again. I wrote it all down and I put it someplace I could find. I really encourage you to get all that stuff in writing for you, for your spouse, and for any other family members that might come along and want to help you. Learn passwords, learn finances, find out about insurances, just so you'll have it available when you need it. Okay, next slide. We, as professionals, what we always say is the most important thing is that we keep people safe. Once they're safe, how you live your life is really pretty much what works for your family. But safety is most important. And Dr. Dermot O'Reilly talked a lot about this. Joanne talked a lot about the resources available to this. But let me just add a few things. One is about driving. Is your family member still driving? And if they are, should they be? There's a long time that people with FTD can drive and drive safely. But at the point that they begin about things or their memory begins to fail, maybe they shouldn't be driving anymore. There is nothing worse. Well, there are many worse things, but one of the worst things that exists is having that conversation and taking someone's driver's license away from them. You can have a conversation. Some people will just say, oh, you don't think I should drive anymore? I won't drive anymore. Not very many people are that easy and agreeable. You can go to your physician and have your physician talk to them. Some people will listen to a physician. You can ask the physician to send them to a driving evaluation at hospitals. I don't know how those are working now. They used to have great in-person driving evaluations at several of the hospitals in Seattle. And they will again, I'm sure, when COVID is over. And then the evaluators send a letter to the doctor, and the doctor says, look, there's proof you can't to get someone safe and off the streets if that's necessary. Both Dr. DeMoto Riley and Joanne talked about ID bracelets and cards that you have that provide information about the person. If your family member still is walking through the community, happily walking through the community, safely walking through the community, that's great. But I really encourage you to maybe get an ID bracelet for them with their name and your phone number on it, because if they get lost or if they get confused or if they do something erratic and someone is concerned about them and they're wearing an ID bracelet, that person hopefully can call you. And you can come right away. I also encourage you to talk to your neighbors and let your neighbors know what's going on. So if they see your family member a little too far from home, or if they see them walking into the wrong house, they aren't going to become afraid. They're going to go and find you, understand the situation, and help you remedy it rather than make things more difficult. So if you can, talk to as many of your neighbors as you can about this. Usually neighbors are very, very, very understanding and supportive. As I say, we talked about the cards you can get and put in their wallet saying that they have FTD, but I would also encourage you to get cards and put them in your wallet. So if, God forbid, something happens to you, you get in an automobile accident, there's a card in your wallet next to your insurance card, first place they always look when you get in an accident, next to your insurance card that says, I have a person at home that can't manage without somebody. Please call this person to make sure they're okay while I'm getting the care I need. Does that make sense? Put a note in your wallet saying that you are responsible for someone who isn't totally independent. And again, those cards that Joanne showed you that you can hand out to people in stores and restaurants explaining someone with FTD's behavior, I think is a wonderful thing and a way to keep someone's dignity intact, which is what we always want to do. All right, I think I've skipped a few slides. If you want to go through the next couple of slides, that's just what we talked about. All right, so all of us want to keep our family members at home. Again, we've talked, Dr. DeMoto Riley talked a bit about this. Sometimes, although right now, everybody's home. At the point that we can, again, go out in the world, there are some great places that you can take your family members and they can spend the day and enjoy themselves. Many people's first thought are senior centers. And on the resource list, there's a list of all the senior centers in the county. The trouble with senior centers is you have to be self-directing. So you have to be able to say, I want to listen to a newspaper being read. I want to go to a knitting class. I want to go to lunch. If you can't be self-directed, it's hard to be at a senior center. And that's what adult day programs are for, adult daycare centers. There are several wonderful places in the community, again, on the resource list that Joanne will send out. And those places, they can pick you up in a van. They can pick your family member up in a van, take them to the center. They spend 5 or 6 hours there. They direct people from one class to another. Oh, you like an art class? We're going to send you to an art class. When you're done with that, you want to hear someone read the paper, we'll send you there. Now it's lunchtime, send you there, and keep people moving throughout the day to activities that are worthwhile for them. Many assisted living facilities allow you to come and spend the day there and participate in the activities at the assisted living facility. Of course, none of that's happening right now during COVID. I think some of it is happening online, but it is something to look forward to in, I think, spring. I'm hoping spring. If you get to the point that you just don't know how to figure out what's available, there are people who do individual consultations. They used to come to your house, now they call you on the phone, they ask you a lot of questions, and they give you information tailored for you and your situation. Sound Generations, which is kind of the senior clearinghouse, does that, as does the Alzheimer's Association. For pay, but Sound Generations and the Alzheimer's Association will do that for free. Joanne talked about support groups, the importance of support groups. Joanne talked about the helplines. The AFTD has a wonderful helpline. The Alzheimer's Association also has a wonderful helpline that you can call and ask for local information about local agencies and places where you can seek help. Again, that will be on that resource list that is being sent out. Also on the return anything to them. So you have a walker you don't need anymore, you can give it to the organizations, Bridge Ministries and the helpline on Bainbridge Island, if you have things that you don't need anymore. So that's a little bit of what I wanted to say about the help from the community. I really encourage you to use that help, and I encourage you to do it because you need a break as well. So next slide. But sometimes people don't want to go out of their house for activities, and then it may be time for you to hire help at home. The first things we all do is we tend to look to our friends and our family, and often at first friends and family are great at helping us, but often friends begin to wary of seeing the person with FTD be so different than the way they were, and they kind of back out. Sometimes if you say to them, bring another friend, have two people come and visit, rather than someone coming alone, then the conversation seems more lively and normal, and that may help them. Sometimes family will help at first, but then they get involved in their own lives and they're not available to be very helpful anymore either, or helpful enough. And that's the point, you need to hire someone from the outside. I encourage people to talk to people they know and see if they know someone who does this kind of work. So you hire someone from someone you know, through someone you know. Often that is less expensive, and it's kind of like you have they've already been, their references have already been checked. If that's not available to you, or if that's not enough help available to you, then there are many, many agencies available to send someone to your house. Look under caregivers on the internet, or help in the house in the internet. What I encourage you to do is find an agency that you can work with the people on the telephone, or the first person who comes to your house. The workers may work for any of many agencies, but what you need is someone who understands your needs and finds that worker and sends it to you. And towards that end, you really need to be as clear as you can about your family member and what their needs are and what their behaviors are, and what kind of person they will want. Do they want somebody who sits in the back room and shuts the door and pretends they're not there, but just to assure they're safe so that you can go off to work? Or do you want someone who keeps them occupied and takes them out for walks and cooks for them and cooks with them? Be clear about what kind of person you want to be your caregiver. Be clear about the kind of activities your family member does so that they understand who would be a good match for them. And I really encourage people to really make a job description, an hourly job description. So you get here in the morning and you help them make breakfast and eat breakfast, and then you make their bed, and then you watch television with them, and then you go into the kitchen and you do the dishes, or you make lunch for them, and while they're resting, I want you to vacuum. Those are the kinds of things that if you put in writing for people, they're more likely to do what you want them to do. Otherwise, they just don't know. They'll do what they think is best, but it may not be what you are expecting. So more clarity, better. All right, so that's hiring help in the house. I know it is hard to have somebody in your house. And I know often family members don't like having people in their house, but it may be the best way to keep them home and keep you from burning out. But there often comes a time, next slide, that you can't keep them home anymore. At the point that somebody isn't safe at home, they're falling or they're wandering out of the house and you can't keep them from wandering out of the house. At the point that they can't follow directions anymore, it may be time for them to move. And there is nothing worse, I totally understand, nothing worse than having to make that decision, because I know you made the promise that you were going to keep somebody home forever and ever. It is not you that is failing, it is the disease that is causing the problem. And I really want you to hold that thought. You are not failing at this. It's a terrible, terrible, terrible disease. If you decide you have to move your family member, then I really encourage you to use someone from a placement agency to find a facility. Those people can be found, again, on the resource list. The placement agencies are listed there, not the agencies, but how you find them on websites. But for those of you who moved your family members, you know that often people say they can take care of people with dementia, but they are thinking they can take care of people with Alzheimer's type dementia, not FTD. And it is hard to find a facility that understands and can care for someone with FTD. So I encourage you to not only talk to the marketing person that you meet and takes you on the tour, but you ask to talk to the nurse in the memory unit or in the unit that your family member might move to, and talk about the specific behaviors that they have, and ask them how they would deal with those behaviors. And let them give you answers. Don't just say, can you deal with somebody who walks around in circles all day long? Or can you deal with someone who tries to get out a door all day long? Because their answer will be, of course we can. We know how to take care of dementia. I want to know how you're going to take care of it, because those behaviors may appear for them. And the facility does need to understand and have a plan for taking care of them. I often think, I like a lot of memory care units, and there are good memory care units that can do FTD. Often adult family homes where 3 to 5 people live do a better job of doing the one-on-one care that someone with FTD had, the issues of someone with FTD. That's what I have to say about moving. In closing, like Joanne said, like Dr. DeMotte O'Reilly said, this is a lot about your being able to shoulder the burden. And if you're not taking care of yourself, the whole house of cards will fall down. So please take care of yourself. Please consider going online and looking at the chat rooms. Please join our support groups. And I thank all of you for the work you're doing. I really honor you for just being here. It tells me how hard you're trying to take care of somebody. So thank you. Any questions?